Hi there, welcome to an introductory video on congenital heart disease. Your heart is a complex organ, but we're gonna boil it down to an old-fashioned mechanical engine first. Let's break down this engine into three easy parts to remember. Firstly, there are chambers. These fill with blood and are compressible. In between these vertical chambers are valves or moving parts. Lastly, there is tubing that transports blood to and from the heart. In congenital heart disease, some of these structures are not formed properly at birth, meaning there are blockages or leaks, and this is different from the normal wear and tear your heart goes through over time. To understand congenital heart disease, we have to look at how a normal adult heart functions. We start with deoxygenated blood entering the heart through the tubes we call superior and inferior vena cava. Keep in mind that we are looking at someone else's heart from the outside, so the right side of their heart is on the left side of the screen. The tubes lead the blood to the right atrium. It goes through the tricuspid valve and reaches the right ventricle. The right ventricle is a powerful chamber that squeezes the blood through the pulmonary valve into the pulmonary artery. The pulmonary artery is the only artery in the body that carries deoxygenated blood. It finally makes its way into our hard-working lungs that oxygenate it, giving it a bright red color. The red blood now re-enters the heart through the pulmonary veins, which are interestingly the only veins in the body that carry oxygenated blood. It makes its way to the left atrium and finds its way through the mitral valve into the left ventricle. This is normally the most muscular chamber in the heart. It pumps the blood through the aortic valve into the aorta, where it is now free to go into the rest of the body. Now that we have seen how a normal heart functions, let's look at how different congenital heart defects present. We will start with valve problems. If the opening of the valve is narrowed, it can obstruct blood flow, and this is called stenosis. There can be partial or complete obstruction. There are 4 valves that can get stenosed. There is tricuspid valve stenosis, pulmonary valve stenosis, mitral valve stenosis, and lastly, aortic valve stenosis. Problem with valves means the heart has to work harder to pump the same amount of blood, meaning certain areas of the heart may thicken. For example, in aortic valve stenosis, the left ventricle might be strained and eventually develop left ventricular hypertrophy. Now that we have seen the valves, let's go back to the chambers. We will talk about the vertical divider between the chambers called the septum. To explore this, we will go back in time to the heart of the fetus. Let's take a closer look at the fetal heart without all the vessels and tubing in the way. The lungs of the fetus do not work, so the mother supplies the fetus with oxygenated blood. Thanks, Mom. This blood enters the right atrium and takes a shortcut to the left atrium through a shunt called the foramen ovale. This is a natural adaptation to bypass the lungs and is present in the normal fetus. However, if the foramen ovale does not close after the newborn enters the world, then it becomes a problem we call the patent foramen ovale. Sometimes the septum or the divider between the atrial chambers never fully form, so we call these atrial septal defects. If the same problem occurs between the ventricular chambers, we call these ventricular septal defects. These atrial and ventricular septal defects lead to the mixing of oxygenated and deoxygenated blood in the adult heart. That makes it an inefficient system. Now, let's talk about the tubes or the great vessels of the heart. Another adaptation in the fetal heart is the ductus arteriosus. It is the bridge that shunts oxygenated blood from the pulmonary artery of the fetus to the aorta, therefore bypassing the non-functional lungs. However, if it continues to stay open long after birth, then we call it patent ductus arteriosus. A mismatch of the tubes can occur in a condition called transposition of the great arteries, where the aorta and pulmonary artery switch places. Like a viral song on the radio, blood is stuck in a loop on both the right and left sides of the heart and are not able to communicate with each other. Much like the pipes in a car, the tubes can also have problems with their structural integrity. For example, in coarctation of the aorta is pinched and the blood flow is limited. So then, is it possible to have multiple problems at the same time? Absolutely yes. In tetralogy of Fallot, you can have an overlying aorta, an interventricular septal defect, a stenosed pulmonary valve, and lastly, an extramuscular or hypertrophied right ventricle. So then, how does congenital heart disease present at the physician's office? Well, breathing can be strained. It can be fast or slow. There is also weight loss that can occur with poor feeding. You can hear murmurs upon closer inspection with a stethoscope. Lastly, there can be exercise fatigue found in older children with these congenital heart defects. Notice how the acronym spells out blue. This is because with certain, but not all, congenital heart defects, a blue tinge is noted on the skin. The medical term for this blue tinge is cyanosis. Unlike a car with a hood that we can open to look at the engine, we need intricate tools to look at congenital heart defects. We can image the heart using special equipment. Special equipment that we can use to look at the heart include a chest X-ray that can highlight vague structural abnormalities, an MRI or cardiac CT that shows greater detail, an ultrasound of the heart called echocardiogram that can visualize the pumping action, and an ECG that can graph the electrical activity of the heart. We can also insert a line from the peripheral veins to the heart in a process called cardiac catheterization. This allows us to closely monitor pressure and oxygen saturation, as well as how blood may mix in the heart. Although we won't go into detail about the surgical and non-invasive procedures that is used to treat congenital heart disease, you should know about some common medications that are used to control symptoms and to treat the disease. These include ACE inhibitors that reduce blood pressure and dilate blood vessels, beta blockers that lower the heart rate and blood pressure, diuretics that help create more urine and therefore decreases the volume of blood that the heart needs to pump. Digoxin and inotropes help create powerful contractions in the heart chambers. As we talked about, our heart is an amazing organ made of specialized parts that can work in synchrony. Congenital heart disease affects 1 in every 100 newborns, but now, thanks to medications and surgical treatments, there is a 90% chance that these affected individuals will reach adulthood. As our knowledge widens and new treatments are found, perhaps one day, the story of congenital heart defects will become a tale of the past.